Lujan.
Well, back, new regional hospital is our topic tonight with Mr. Pete Sgro, who's the president and chairman of the Guam Healthcare and Hospital Development Foundation.
Correct.
Well, that's a big name tag.
We've done a lot over the past 10 years.
Yeah. Let me talk to you about this hospital. Give us an idea of what this hospital, you already told us about the beds. You know, one of the things that talked about in regards to people who have not just elective surgery, but surgery in general. A lot of people are delayed because of the lack of rooms. How many surgical rooms are there in this hospital will it have?
You know, just before I answer that question, I think it's important your audience know that in designing this hospital and getting the equipment and really studying what it should have, it took 2 years. A lot of interviews of let's say, the Cancer Coalition, looking at data of how many people we have diabetes, heart disease. So it was really tailored around our community in general.
So it was tailored to Guam's needs and Guam's ailments, basically.
Correct. Like, for example, we have 40,000 diabetics. There's not very many communities in America that have 40,000 diabetics. And, you know, number of amputees, heart disease, the number of cancer patients we have about 3 men and up to 2-point-some women diagnosed with cancer every single week. So, for instance, this hospital is going to have a full cancer center, which we don't have now. There's an awful lot of people that leave our island monthly for cancer care. You don't have to leave anymore. There's a total of 10 operating rooms. And the nice thing about the 10 operating rooms is 2 operating rooms are larger rooms. We'll be able to have the capacity to do kidney transplants right here in Guam. You can't do, like, for example, heart transplants. In many communities that are as small as ours, you have to have really a larger population.
Yeah, larger population and the team consistently.
Correct. And, you know, emergency room, intensive care units, neonatal intensive care. You're going to have labor and delivery rooms. Even in the design phase, there was some guy from Wisconsin, you know, they never even heard of a viewing room after a person dies. You know, they even had focus groups. We brought in the mayors. How does a person die? I mean, that's really how it's tailored to Guam. So this hospital is going to have 2 viewing rooms, whereas, you know, if it was designed by a guy in San Francisco or elsewhere, there would be no such thing as one in the corner. One in the corner somewhere. So this Guam Regional Medical City is for the people of Guam. It's always intended to be for the people of Guam. And, you know, I will, as well as the people that have advocated for this, we're not going to be distracted by a few doctors, you know, because we're all about wanting to provide quality care for our people. And, you know, the distraction with them is really, oh, how about me? And, you know, for us, it's how about the patients. It's not about fairness anymore to doctors. This is about fairness to our people. It's just come to the point, Jess, where, you know, I don't know if you've seen this, but on one trip, I'm seeing a guy on a stretcher in an airplane. Or you're seeing how many wheelchairs are waiting.
I'm seeing more of that. More often than not. That's right. That's right.
And, you know, it comes to a point of, as a community, you know, we just can't accept that anymore. And you know, I believe Guam's better than that. The people of Guam deserve better than that. And, you know, that's what we're going to keep doing.
Can you solidify something for me? It's come to my attention, actually a couple of days ago. I was calling, it was very disturbing that I heard this. You know, it's disturbing enough that you have doctors like Dr. Shea that you know, just totally adamant against you know, any QC for this hospital. But it has come to my attention that there was a female doctor a couple of days back that I heard that stood up in a medical, I guess, organization meeting, and stood up and basically said, "I hope this hospital fails." Is there any truth in it?
Actually, you know, yes. And the sad thing about it is that the CEO of the hospital was giving really a speech of how do doctors work in the hospital locally, how do you get credentialed. And when it came to the question and answer period, you know, her comment was something of the sort that history is going to repeat itself, this hospital will fail. And, you know, it's not like we're talking about a garage. You know, we're talking about a place where people are going to either live or die, or there's going to be doctors or teams of specialists that are going to try to keep your family member alive, you know, keep me alive, keep you alive. And, you know, for a comment like that, especially from a doctor, you know, For me, Jess, I've learned to just not listen to it anymore.
Well, I mean, that even reminds me of even a doctor telling a patient, I hope you die, and that's really a shame. So you doctor, I mean, I know who you are, okay, and I'm calling you out on this. You're lucky I'm not mentioning your name. But I will, because, it's really against your Hippocratic oath to mention something like that for our people of Guam, a hospital that we desperately need. 60 million annually leaves our island. Imagine capturing even 10% of that, if we can keep at least 10%.
Well, just the other thing to add, that that's what's happening. As we speak, tomorrow again, there'll be 320 construction workers working. That would be out of a job because there's no military buildup, and they're working. It's a $250 million that these people are putting into our island. Not only that, it's going to create 400 new jobs. The outsourcing of laundry, the outsourcing of maintenance, the outsourcing of food. This is really a win-win for Guam. And like I said, it's something that has been worth fighting for the past 7 years. And, our foundation, its members, and a lot of people in this community that support us, we're still going to be there.
Well, I mean, the community, we support you. I mean, where are we going to go at this point? I mean, I was looking at a situation here. I mean, we all were glued to our TVs a week ago, the situation that happened in Boston. The world was glued to that.
Right.
And of course, patients were taken to different hospitals because of the overcrowding and things like that. I mean, I just put ourselves, what if this happens to Guam? What if this happens to Guam? Are we ready? Would we be better suited if we had 2 facilities? We'd be a lot more ready if we had 2 facilities as well. But for people in the medical profession to say something like that, I mean, it's like we are our own worst enemy, people.
Yeah. Jess, you bring up a good point, but let me just give you an example. Yes, we saw the bombs blow up. Yes, if it happened here in Guam, we're going to need a lot of attention, a lot more beds. But let's say the 2 of us are talking as we're talking now, and you had a heart attack. We don't have to have a big blow up. There would be no cardiologist to take care of you at the Guam Memorial Hospital. Yeah. Any of your listening audience that has a heart attack now, we don't even have a cardiologist. We rely on internists to take care of our heart if we have a heart attack. So we're not just talking about it has to be a major catastrophe. We don't have enough doctors on this island. We need, we estimate about 100 more doctors on this island. The United States Department of Health and Human Services, we're a physician shortage area. I can go on and on with the statistics, and these are justified. We're going to stick by them, and because we still have not been able to have anybody, contradict what we've said.
Take a break, come back, finish off this segment. Be right back.